go to school?
Where did you go to school?
Where did you go to school?
Kalamazoo Valley Community College.
One other aspect, I guess, historically that needs to be just talked about is the education of respiratory therapists. I believe the first school that existed in Michigan for respiratory care was Washtenaw Community College in Ann Arbor. Not surprising, being that they had one of the first first hospital-based departments.
Oh yeah, respiratory education's changed a lot over the years. When it first started, it was really on-the-job training, and people went and took the exams after so much experience. KVCC, for example, started out as a technician program in the late 70s. A lot of programs started out technicians, then went to therapist programs. Recently, they've required that you have to have an associate degree to become a registered or certified respiratory therapist. And so that's been a big change in the education requirements. We're moving towards a bachelor's degree. A lot of people think that's the way the profession should be going. I'd be surprised to see a lot of schools become bachelor's programs over the next decade or so.
Now we have a nice system where some colleges teach in the traditional stand-up lecture. Some are doing a little more with internet, and others are doing primarily lectures using multimedia, internet, and CDs, much like what we're doing. You have to find the way that you can learn best.
I think there's a variety of students. Our younger students are actually probably more skilled on the computer than I am, and they've grown up with it. Our older students maybe not as skilled, but they adapt very quickly. As you know, in the hospital, you cannot do anything now without the computer. You're in the home care arena. You should use a lot of technology. So I think technology is just kind of becoming part of education.
In a lecture, a traditional stand-up lecture, I find myself always drifting off thinking about something else and realizing that I just missed an important segment of information, or I'm not able to take notes as fast as the instructor is speaking. Whereas the non-traditional type of presentations, the online, the CD format, allows a student to review and repeat information and make sure that their knowledge and understanding is according to what the instructor wants them to understand. They can go back over things multiple times rather than just once and miss key information.
The idea of a bachelor's degree versus associate degree has been an ongoing controversy. Certainly, we've been an associate degree program for the last few years. It's been a requirement to become certified or registered. Should we move to the bachelor's degree? I like to put it this way: do we need more education for therapists? I think so. Do you need a bachelor's degree for entry? I'm not sure. But I would encourage anybody out there to get their bachelor's degree, because all the other health professions are moving that way. We don't want to be left behind. I think eventually it will become a bachelor's degree, whether they're going to do that for different levels of credentialing. There's all kinds of ideas out on the table right now, and COARC and MSRC, but no decisions have been made. It's going to be a tough one. The infrastructure is just not there yet for bachelor's degree programs. There's 300 programs in the United States. Only about, depends on how you count them, only about 30 to 50 of those are actually bachelor's degree programs where you have to have a bachelor's degree and graduate in order to get your credential. Most of them have a midpoint graduation, so you're getting an associate degree and then getting an ongoing degree. So that's a controversy out there, but I think it's moving in that direction, and I think any therapist that's young in the field is going to be in there as long as I have and the other people I have been, ought to really think about continuing their education, get that degree. That'd be a very good way to go.
2 years is hardly enough time to squeeze in all the information that we have to cover in preparing students for the matrix. I think we are heading into the 4-year degree, but some of my research, as I looked at the degrees that are around, Michigan only has associate degree in respiratory. Places around the country have a 4-year degree, but some of them are nothing more than associate degrees spread over 4 years. Others of them will expand into management or into education, and very few expand into improving clinical or acute care skills. I think if you're going to have a 4-year bachelor degree, we need to hone those advanced skills in assessing, advanced skills in patient care, in determining what is best for the patient, and that is where we should use the 4-year degree. Also, we could start using some certifications, certifying people in sleep studies, in home care, in other areas of respiratory care, which we just barely brush over in a 2-year degree.
I think that there will be professional competency, continuing education required. The MSRC just put together a white paper on professional competency. What they're suggesting is a concept of professional development credits, which would be similar to what we're doing in CEUs, but they are going to require some marker of competency. Maybe it'll be a skill-based activity, maybe it's somewhat, if you go to a seminar, you're going to have to answer some questions about what you learned. Some level of competencies in this proposal that went to the governor's office, to the Michigan Department of Community Health, on professional competency. So that's all being decided, but I think a therapist can count on being required to do some kind of continuing professional development. The actual numbers and all that are being looked at the board right now. They're meeting at the end of October, right around the time of our Respiratory Care Week. So we should have some answers, I would hope, by the end of the year on exactly what's going to be required for competency.
The most complex aspect is critical thinking. That's where you have to gather information and decide what needs to be done with it. The clinical simulations are really where we're taking that critical thinking and trying to determine what is the best approach for a positive outcome for the patient. In the past, I think many programs tried to teach and make sure that we were putting out students that were professionally competent and met the needs of the community in which they were serving with graduates. Now, as we look at licensure, you need to pass the credential exam. You need the CRT and RRT to work in the hospital, and many hospitals are saying you got to have the RRT to work in ICU. You need a neonatal pediatric practitioner, especially if you're going to work in those areas. So we really need to teach not just the profession as we have in the past, but also how to pass the credential exams.
I'm an educator at Macomb Community College. Actually, it's the place that graduated me also many years ago. I started out as an on-the-job trainee, and looking back at the practice that we did back then, I actually worked as a respiratory therapist prior to going to school for respiratory therapy, which in this day and age would be just unheard of. Part of it is that the level of technology that is there is so sophisticated that you have to have training. And one of the aspects that I tell my students as they come through my program is do not ever believe that what you learn and what I teach you is going to be necessarily pertinent 5, 10, 15 years from now. You have to have continuing education.